Most, if not all of us, would rather not experience pain. After all, who wants to relive the agonizing feeling of a headache or joint pain? Absolutely no one. But believe it or not, pain is actually beneficial. It's the body's way of telling you that something's wrong, a warning sign so that you can protect yourself ahead of time. Of course, that doesn't mean that we should just live with the pain. There are tried and tested ways, from prescription medication to natural methods, to help relieve the pain. I'm Dr. Freddy Gomez. Our goal here on the program is to help you better understand the care you need and deserve. You're watching MedTalk Health Talk on CNN Philippines. People respond to pain differently, with everyone having their own tolerance for different kinds of pain. In short, pain can be very subjective. To help us more with today's topic, let's welcome Dr. Frank Nacario. He's the chairman of the Asian Hospital Pain Management Committee and consultant at the Department of Anesthesiology. Also with us is Dr. Fatima Lao-Tan. She's a traditional Chinese medicine specialist from VRP Medical Center. There are many ways to categorize pain, but for this episode, let's separate it into two kinds: acute and your chronic pain. Now, acute pain can be mild up to severe, but it is usually short-lived. It can come on suddenly, and it can have no specific cause. Generally, it lasts for fewer than 12 weeks and goes away once the underlying cause is treated. Pagdating sa acute pain, what are the more common causes that you see in your practice?
They are the usual dental pain, headache, dysmenorrhea, or even indigestion can be causes of acute pain.
Now, pain that lasts for more than 12 weeks, even after the original injury or causes the pain has healed, may be considered that you have a chronic type of pain by now. Now, it can range from mild to severe and can be present for long periods of time. Dr. Fats, I'd like to ask, since yung pain is subjective, marami sa mga viewers natin probably ang natitiis ang certain amounts of pain in their lives, ano? Pero kapag natitiis pa ang pain, does this mean na hindi kailangan gamutin?
When you feel a mild headache, it doesn't mean sometimes it's on the surface only, this headache, but pinatagal ninyo yung headache, it can lead to a more chronic form of headache. It might be your brain, maybe having a tumor or growing something organic that we do not know, and you miss that golden period to have a checkup with your doctor. So the disorder will be more difficult to treat when you prolong that period, that pain.
What's a good gauge that you can advise our viewers that this type of pain that they're feeling needs professional assessment already?
When they experience the first episode of pain, they take something over the counter, self-medication, and then they get relief, then well and good. But if that pain recurs and with each recurrence, it becomes more severe and getting severe every time, then it really warrants a consult. A good example would be headache. We tend to just take something from our medicine cabinet. We get relief, but then it happens again. We should definitely rule out something more serious like an aneurysm. So a consult with your doctor is really important.
Dr. Frank, please explain further the psychological effects ng pain and pagdating sa mood or sa demeanor ng tao.
Pain is just one aspect of how we report or how our body manifests something that is going on inside our body. Aside from pain, it is actually influenced by our mood, even manifests how we relate with our family, our colleagues, at work or at home. If we are bothered by something, problem at home or at work, it can even magnify the pain experience.
Now, Dr. Fats, pagdating sa traditional Chinese medicine or TCM, how is pain assessed and when is that level of pain deemed proper for TCM intervention?
In TCM, Pain is generally regarded as a result of qi and blood stagnation or deficiency. When the normal flow of qi and blood is blocked, discomfort or pain may be experienced. Qi and blood stagnation may lead to swelling, sore muscles, joint pain, headache, chest pain, or even sore throat. In TCM, we have a very famous saying that goes, if there is free flow, there is no pain. If there is no free flow, you will feel the pain. Meaning, as long as the qi or the vital energy and blood flows freely and smoothly without hindrances within your vessels or channels, there will be no pain.
Now, first, let's discuss pain relievers or methods in which to address the pain that you feel. I'll start first with Dr. Frank. In conventional medicine, what do people usually buy? Ito yung mga over-the-counter medications. Ano? What is the type of medications that can usually address mild to moderate pain that is over-the-counter?
Our mothers, no, they give us mefenamic acid, paracetamol, diclofenac, no, the usual pain relievers that they give us for whatever that ails us. And usually they are of inflammatory origin, meaning you need an anti-inflammatory drug, and that's mefenamic and diclofenac.
Dr. Fats, pagdating sa TCM naman, what is the more common procedures done para or things given kapag may mild to moderate pain?
Acupuncture is a very popular method, even here in the Philippines. It usually treats pain but not limited to pain. So in order for an acupuncturist to diagnose these conditions, he must answer the following questions. If the pain is due to blockage, to qi or blood, or it is due to a deficiency state. If the pain is due to blockage, is the pain characteristic of a qi stagnation or a blood stagnation? What pathogenic factors are involved? What channels are involved? What internal organs are involved? The answer to these questions will directly determine the treatment that the patient will receive from their acupuncturist or TCM practitioner.
Now, Dr. Frank, on the conventional medicine side, is there a proper way to take these pain relievers?
A good guide would be the instructions written at the back of the box or on the bottle. No, the manufacturers actually suggest a safe dosing guide. So if you're self-medicating, that will do.
Now, Dr. Fats, when it comes to TCM, ano ang mga na-address ng acupuncture? Is it mostly mild to moderate pain?
Most pain conditions, including low back pain, shingles, and other nerve pains, hand and knee pain like arthritis, headache, fibromyalgia, and menstrual pain. Acupuncture is also used for other conditions like insomnia, myoma, tinnitus, and vertigo, to name a few.
Now, medications and procedures that address pain are both valuable for doctors and patients alike. But like all medicine, whether conventional or TCM, they can have some certain limitations or even side effects which must be addressed. When we return, we'll talk about what these are. We're your connection to healthcare. You're watching MedTalk Health Talk. Now, the aim of addressing pain is to improve your quality of life. But pain relievers also have potential side effects. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. We're together in health. With regards to conventional medicine, over-the-counter medications, ano yung mga risks dito? Lalo na kapag hindi nagpapacheck muna sa doktor whenever buying over-the-counter medications.
Let's start off with paracetamol. It's really relatively safe medicine, even on extended use. But there should be caution in patients using them if the patient has a liver disease. No, the liver function is below normal. Another group of drugs are the non-steroidal anti-inflammatory drugs or the NSAIDs. No, on short-term use, it is fairly safe. It is a very good anti-inflammatory drug. But on extended use, unsupervised, it can cause hyperacidity, even gastritis, even bleeding from the stomach because it has a negative impact on the lining of the stomach.
Marami siguro ang mag-wonder, over-the-counter medications, mataas ba ang risk ng overdose pagdating dito?
You just follow the the recommendation of the manufacturer, then I think you're fairly safe. But a big caution would be on the non-steroidals.
Now, Dr. Fats, pagdating sa TCM naman, pwede bang sumobra with certain procedures like acupuncture? Are there any risks that our viewers need to know about? Anything that they should be aware of?
The patient should make sure that their doctor or the practitioner should be certified under the regulatory body of alternative medicine, the PITAC, Philippine Institute of Traditional Alternative and Healthcare, to ensure that the doctor knows what she's doing. Okay, in acupuncture, we do not limit actually on how many sessions do you have in a week. In some cases, we can have, if patient is okay with their time and doctor's time, we can suggest 3 times a week to 2 times a week.
Are there any over-the-counter medicines that should definitely not be combined? For the most part, they are generally safe. But are there anything that our viewers might, any added knowledge that our viewers would need to know?
For difficult pains or for difficult or complicated pains or for chronic pains, actually what we do is we combine medications. We combine medications, making use of the different mechanisms available. So when we combine medications, we just make sure that they target different mechanisms, and it's called multimodal pain management. But when we talk about over-the-counter medications, it has to be supervised. If the pain keeps coming back, ang aray or ang kirot na pabalik-balik or paulit-ulit ay kailangang alamin kung bakit siya nangyayari. No? Just to make sure that it is not something bad, no? And we're too late when we need to intervene.
How about in TCM? If there's different factors of pain, are there also a combination of procedures or treatments with TCM?
We also have different kind of pain, like pain due to chi stagnation is different from pain caused by blood stagnation. It has a different feeling on the patient. Like pain caused by chi deficiency is different from pain caused by blood deficiency. In TCM, we also have this kind of categories.
Now I'll go to what happens kapag yung over-the-counter medicine hindi gumana or the pain is too great for that over-the-counter medication or acupuncture to be able to help. Where does the patient go now? I'll start first with Dr. Frank. What does the patient do now? Over-the-counter medications does not work for the level of pain that they have. What is the next step?
It's a signal. So we should consult. We should consult whether they are our family doctor or a specialist, at least somebody who can assess and do again your history taking. All of us doctors who trained during med school, we were taught how to get information from the patient. And those interviews, those history taking are really important, and it will guide you on the next step to do. So a pain that is refractory or unrelieved or doesn't get better with the medication that the patient is taking has to be investigated. And a consult is the only thing that we can advise to our viewers.
Sa TCM, Dr. Fats, kapag nag-acupuncture na yung patient, hindi pa rin na-relieve, is there a next step up?
We will reevaluate the patient. We'll see how far that we have gone. If the patient really did not kahit konting improvement, same with Dr. Frank, we'll check history again, and if laboratory is needed on the Western medicine side, Western and Chinese medicine works hand in hand, especially in these difficult to treat conditions. So we can give herbs also to assist acupuncture. We'll also review the prescription points if we have missed something, or we need to do laboratories to further check the patient.
That's right. So all of these dapat nasa guidance with your physician or your doctor. Now, aside from medications, there are natural remedies that may help treat and alleviate mild or even moderate pain. We'll talk about this and more when we return. Your health is our mission. This is MedTalk Health Talk. When you're in pain, your first impulse may be to reach for medication. But there are other natural remedies that may help. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines, where your care comes first. As part of some of the natural ways to relieve pain, a very common practice now is the use of essential oils. Is there any basis for this? Is this something that our viewers can use to relieve pain?
To tell you the truth, this is not really my expertise, but I've read on it. I encountered patients, even some relatives and friends who use them. So there's actually a published study. They analyzed different researches on using essential oil. So primarily, the main result out of that study was that it was beneficial in relieving pain. But they couldn't really ascertain what's the mechanism, why it works, in relieving pain. A second important information from that study is that it is part of the whole management of pain, meaning that it's not the only intervention for pain. So there is one theory why it works. It actually targets or stimulates a center in the brain or receptors in the brain that brings about comfort. And if the patient is comfortable, so it distracts the patient or the person from the pain. Hence, he gets relief. But again, for its use in the overall picture of pain management, it actually calms the patient down. It works like an anxiolysis, It makes the patient comfortable, but together with the conventional medicine, so the different medicines that we give, rehab and physical therapy, the complementary medicine that Dr. Fats does, and this is actually more applicable for chronic pain sufferers, so those who are having pains for some serious conditions.
For mild to moderate pain, they're at home, wala silang over-the-counter pain relief. Are there any ways that you would suggest, Dr. Frank, that could be possible to relieve that pain?
For muscle pains, we are familiar with this, the topical pain relievers. There are a lot of options available. So you have liniments, you have there are even NSAIDs who come in cream form that can be used as a topical for topical application, and there are even anesthetic creams, that you can use.
When it comes to TCM, how big of a role are topical balms and oils with the relief of pain?
It is generally safe. It's over the counter. You can buy that without prescription. But again, it is better to be guided by a physician, a licensed practitioner who is knowledgeable to guide you on the usage of these ointments and cream. Because any medicine, whether it is oral, it's topical, or sublingual, or in whatever forms, they have side effects.
This discussion was very helpful. Thank you, pain management specialist Dr. Frank Nacario and traditional Chinese medicine specialist Dr. Fatima Lao-Tan. We want to be your partner for a lifetime of good health. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk.